Assalamualaikum warahmatullahi wabarakatuh. Good morning to the all participants the 6th International Conference on Biophysical Technology in Dentistry. So good to see all of you by online. Today I would like to show our literature review with the title The Effectiveness of Root Canal Disinfection in Supporting the Success of Regenerative Endodontic Procedure, a literature review. Before I start, I would like to introduce my supervisor, Dr. Gigi Juni Jekti Nugroho, SPKG Consultant. Thank you, Doc, for your guidance, so I can be able to finish this literature review. And let me introduce myself. My name is Aryuni Gaffar. I'm resident of Conservative Dentistry Department, Hasanuddin University. I will begin to present my literature review. The contents of my presentation are: first, introduction; second, literature review; and the last, conclusion. Introduction. Three main challenges in regenerative endodontics are microbial control or bacteria reduction. Adequate microbial control is necessary for stem cell recruitment, survival, and proliferation. Second, release of growth factors and adequate recruitment of stem cells. Specific growth factors are required to be released for stem cells to differentiate into odontoblasts. And the last, appropriate scaffold to regenerate the pulp dentin complex. To fulfill these three objectives, a number of clinical procedures have been performed using different irrigants and intracanal medicaments. The purpose of this literature review is to explore, collect, describe, and discuss the latest findings regarding the effectiveness of root canal disinfection that supports the success of regenerative endodontic procedure. Literature review. A good understanding of the role of stem cells, scaffolds, growth factors, and their properties has prompted researchers and clinicians to reanalyze the principles of tissue engineering to develop more predictable and successful outcomes in regenerative procedures. These indications led to the addition of another important factor to the existing triad, which included adequate disinfection of the root canal space. We can see at this picture about this infection package interact with stem cells, scaffolds, and growth factors, and usually called as the classical triad of tissue engineering in regenerative endodontics. Regenerative endodontics procedures can be described in three main steps: are disinfection, evoke bleeding, and restoration. The choice of irrigation material for pulp tissue regeneration is not only based on its bactericidal or bacteriostatic properties, but also its biocompatibility with stem cells and its ability to increase stem cell viability and proliferation. Disinfection is part of microbial control or microbial reduction, one of the major challenges in regenerative endodontic procedure, where adequate microbial control is required for recruitment, survival, and proliferation of stem cells. Cumulative proportions of different uses of disinfectants in regenerative endodontic procedures from 2001 to 2017. Based on diagram A and B, we can see that 5 until 6% sodium hypochlorite and triple antibiotic paste were the most frequently used irrigation solutions and intracanal medicaments. However, the trend in the use of irrigation and intracanal medicaments that varies every year shifts every year. This is due to an increasing understanding of the biology of stem cell-based regenerative endodontic procedure. In recent findings, the use of irrigation sodium hypochlorite 2.5 until 3.5% and ethylene diamine tetraacetic acid have become popular, while for intracanal medicaments, the use of triple antibiotic paste is relatively popular among clinicians. There are three microbial control techniques in the root canal space: first, instrumentation; second, irrigation; and the last, intracanal medicaments. Mechanical instrumentation was used to eradicate bacterial biofilms adhering to the dentinal walls that were resistant to irrigants and intracanal medicaments, but generally not recommended for regenerative endodontic procedure because instrumentation makes the dentin walls of immature permanent teeth thinner. Therefore, bacterial elimination in regenerative endodontic procedures is suggested with the use of more irrigation and intracanal medicament. Irrigation plays an important role in the early stage of the disinfection process for biofilm elimination. Clinical considerations: American Association of Endodontics or AAE recommends using 1.5% sodium hypochlorite followed by 17 ethylene diamine tetraacetic acid for regenerative procedures. Another irrigation material that is often used in endodontic procedures is ETA 17%. Its role is mainly due to its calcium chelating properties, which can remove the smear layer formed during mechanical root canal preparation. Intracanal medicament. The final step in root canal debridement is the placement of an intracanal medicament. This step was carried out to achieve microbial control in the root canal in regenerative endodontic procedure. Triple antibiotic paste. Medicament methods that can be used in regenerative endodontic procedure are triple antibiotic paste, double antibiotic paste, and calcium hydroxide. The protocol recommended by the American Association of Endodontics is the use of triple antibiotic paste with a concentration of not more than 0.1 milligram per milliliter. Double antibiotic paste consists of a mixture of ciprofloxacin and metronidazole. Because it does not contain minocycline, its ability to eliminate bacteria is less than optimal compared to triple antibiotic paste. Calcium hydroxide is recommended as an intracanal medicament in regenerative endodontic procedure because of its good antimicrobial properties. Conclusion: the success of regenerative endodontic treatment is strongly influenced by the steps of root canal disinfection and the biocompatible disinfectant materials with stem cells to ensure the success of regenerative endodontic procedures. That's all of my presentation. Thank you for your attention and Assalamualaikum warahmatullahi wabarakatuh.